Hello, and welcome to my office. My name is Dr. Susan Marra, and I'm a naturopathic doctor here in Seattle, and I specialize in the treatment of Lyme disease and co-infections, or chronic Lyme disease. Today we're going to talk about serotonin. Serotonin is a neurotransmitter in the brain that is very involved with regulating mood. And the reason we're going to talk about it is that it seems to be affected in many of my patients. And that is reflected in urine metabolite tests that I do. In other words, we measure the tryptophan and the serotonin metabolites in the urine, and we can see how much you're excreting. Now, one of the problems with that is that that doesn't necessarily reflect the serotonin availability in tissues. And serotonin is extremely important because it's a neurotransmitter that's not only produced in the brain, but it's also the primary neurotransmitter produced in the intestines. So it's really important that we have a adequate amount of serotonin in our body for normal gut health and for normal brain health, and actually for general normal health, because there are serotonin receptors on many organs of the body. So I want to turn to the board right now and talk to you about the synthesis of serotonin. Serotonin starts out with the amino acid known as tryptophan. And in the presence of a variety of different important molecules, specifically vitamins, including B6, magnesium, B12, and folate, tryptophan gets converted to 5-hydroxytryptophan. And 5-hydroxytryptophan then gets converted to 5-HT, which is serotonin. So this is an important biochemical pathway in your body, and the reason that I wanted to talk to you about it today is that one of the ways that I see it upset in a lot of patients is that my patients come in on what are called SSRIs. So SSRI stands for Serotonin Reuptake Inhibitor. So what that means is these drugs, and one of them is Lexapro, Prozac is another one. Basically what happens is these drugs inhibit the reuptake of serotonin postsynaptically, so thereby increasing the amount of serotonin postsynaptically. In other words, the space between neurons. Okay, so it potentiates or allows for serotonin to remain in the synaptic cleft for a longer period of time, and therefore bind to the postsynaptic receptor membrane and carry out its duties. Serotonin is a very interesting neurotransmitter because it's involved in both the maintenance of mood, and we see that in patients who have anxiety and depression. They oftentimes will have aberrations in their serotonin pathway. Serotonin is also a little bit involved with sleep because it is one of the precursors of melatonin, and melatonin is the hormone that's secreted by the pineal gland and helps you maintain a circadian rhythm. So serotonin is important in sleep, and it's important in mood, and it's important in regulating appetite, helping to regulate appetite. So I hope that this short lecture on serotonin and the importance of vitamin B6, magnesium, vitamin B12, and folate, which is also a B vitamin, in the production of the hydroxylated or methylated form of 5-HT, has helped you understand why the amino acid tryptophan is important in maintaining adequate amounts of 5-HT. Tryptophan you can take in an oral capsule form, and you can also take 5-HT in the oral capsule form. You can take actually anywhere along this biochemical pathway, and oftentimes you can raise serotonin levels that way. So I hope this has been helpful to you, and I hope you have a wonderful rest of the day. Thank you so much.